Hey, welcome back. So we're talking about today a low ferritin without a low hemoglobin. This is diagnostic of iron deficiency without anemia. Low ferritin, no low hemoglobin. So your CBC is normal, right? I was reminded again today of the value in checking the ferritin and the hemoglobin and how necessary it is to get the ferritin over 70 nanograms per milliliter at a minimum if a person is having hair loss related to iron deficiency, because otherwise you're not going to get the hair back. It's not going to stop falling out. A patient of mine had been having chronic hair loss from iron deficiency without anemia and had not seen any change in this. But after a little over 3 months of keeping her ferritin over 70 nanograms per milliliter, guess what? Her hair has finally started growing back, and the crazy anxiety, stress she was experiencing related to whether or not she was going to go bald, at 38 years old, has finally dissipated. And there's just, she's so excited, so happy, because she finally figured it out. So, in a study of women without systemic inflammation or otherwise underlying metabolic disorders, ferritin levels below or equal to 30 nanograms per milliliter were strongly associated with hair loss. So, 30 is way down the stream, right? 30 is like, that's not even minimum. That's like way down. We're like in a disease state now. So in my experience, in order to see hair loss stop and regrowth to occur, a person's ferritin, and in my experience, mostly females I'm talking about, needs to be over 70 nanograms per milliliter. And they got to keep it that way for a good 3 months to actually see the whole hair loss process and hair regrowth process to start. Because some of my patients, I haven't actually seen the stop and regrowth happen until it was over 120. So that can be, you can think, it's got to be something else. But if the hair loss is associated with low iron, then the bottom line is you just got to get that iron up, got to get that ferritin up. So do not give up. And in the process, make sure that you're consuming enough protein to maintain, the infrastructure you need to grow hair and grow strong, healthy, vibrant hair, while keeping that ferritin above 70 nanograms per milliliter. And if you're not noticing a difference and you know that your hair loss is related to iron deficiency, then potentially you would want to get up over 120. All right, hope this is helpful. Do not give up. It is possible to get your hair back, even with a low ferritin, and even if your hemoglobin is normal. Do not give up. Get that ferritin up. It's okay if your hemoglobin is normal. You can still be iron deficient, and you can still be having hair loss related to iron deficiency. All right, Dr. Matt, talk to you later. Please like, share, send this around to anybody you know that's dealing with iron deficiency and is feeling like, when is this going to stop? When's my hair loss going to stop?